There's no vaccine shortage in Canada, just a shortage of people getting the shot, according to some health officials. And as Kelly Crowe reports, part of the broader discussion is how well the flu shot works anyway.
With all that coughing, shivering misery from coast to coast, is this a bad flu year? Not really. The experts say it's just a normal flu season, and we haven't seen one for a while.
People have become blasé about the flu because we have had mild years.
Health officials say this year's flu outbreak may turn out to be the worst we've had in years.
2003's flu season was worse.
This year's flu is hit with a vengeance.
Although 2007 was also nasty.
In some British Columbia schools, nearly 1 student in 5 is homesick.
Compared to other seasonal influenza, this is behaving like an H3N2 type season. It's about on par with what we last experienced in 2007, 2008.
Back then, the flu vaccine was believed to be 70 to 90% effective, but not anymore. A new study is showing that this year's flu shot offers only 45 to 50% protection.
Fever?
Yes.
Did you have a cough?
It's an early finding based on data being gathered on the ground right now by doctors like Wendy Tink in Calgary.
In our office, we actually have this lovely little form that goes to the Tarrant Viral Watch and the little device to take the swabs.
She tests every patient who comes in with flu-like symptoms, asks them if they got a flu shot, and sends off the results. Several hundred other doctors across Canada are doing the same thing. And what's emerging is evidence that this year's vaccine is only working about half the time.
Certainly, 45–50% efficacy or effectiveness is not as high as we would like. Our goal would be to provide complete protection.
Dr. Shahid Hussain is an infectious disease expert at a downtown Toronto hospital. He got the flu shot, and he also thinks he got the flu.
Headache, nasal congestion, sore throat, some cough, fever, and body aches all over.
A major U.S. study released last fall showed flu vaccines were only about 60% effective.
It was a little bit surprising because we normally say 70 to 90%.
And now, with new evidence that the vaccine is only 50% effective, the pressure is on to build a better one.
There's lots of investigational work happening right now looking at how do we make more broadly protective influenza vaccines, something that you could give once every 10 years and it protects you across multiple strains of influenza.
Back in Calgary, Dr. Wendy Tink has only seen a handful of potential flu cases so far, and only one tested positive.
I actually don't see that many patients with truly an influenza-like illness. So for me to have done maybe 3 to 5 swabs this fall, that's actually a lot for me.
But there are lots of other things making people sick right now.
We have lots of people coming in with coughs and colds and asthma exacerbations or chronic bronchitis exacerbations.
Dr. Hussain still believes in the flu shot.
You know what Wayne Gretzky said? That you miss the 100% of the shot that you don't take.
Health officials agree. Their message now, 50% protection is better than no protection at all. Kelly Crowe, CBC News, Toronto.
Well, Dr. Michael Gardam is no stranger to the National. He's the Director of Infection Prevention and Control of the University Health Network in Toronto. Tonight, he's in Seattle. He joins us from there. Dr. Gardam, lots of questions still remain in spite of all the ones we've answered already on those items. Let's start with this one. I just had my shot today. Have I waited too long? Was today too late?
To be honest with you, it's probably not too late, but you would have been better off getting it in October. Certainly, probably the peak that we're seeing now is going to start to wane, and it's going to take 2 weeks for your antibodies to kick in after getting the flu shot today. So my advice would be for next year, get it in October. All right.
The vaccine itself, how strong is it to deal with the flu strain that we're seeing this winter?
The vaccine that we're using this year is a very good match with the virus strains that are actually circulating. So it's not like some years where the virus is mutated and the vaccine doesn't work so well. What we're really seeing here is, actually, despite that match, the flu shot still is not performing all that well, and that's been something that is, as you mentioned earlier in the show, has been identified over the last couple of years. We've sort of tended to overestimate how well the vaccine works. And really what we need to do is start thinking about building a better vaccine.
Okay, so you feel sick. How do you know it's the flu and not just a bad cold or some other virus?
Well, certainly influenza-like illness, typically we look at things like having fevers, total body aches, headache, cough, a little bit less runny nose, that sort of thing. Typically the flu makes you feel worse than something like the common cold. But that being said, there's still a number of viruses out there that can cause symptoms that look identical to influenza, such as respiratory syncytial virus. So really the only way to know for sure is to go to a doctor and get one of those nasopharyngeal swabs to really see what virus you have. And of course, most people don't actually get to that step.
Well, at what point do you go to the doctor?
Well, really, you know, it's often a bit hard to say, but in general, if you are feeling, you know, particularly sick, difficulty breathing, perhaps if someone you're living with who has these symptoms, you know, doesn't seem quite all there, those are good, you know, indications that perhaps, you know, you're getting very, very sick with this. Also, if your fever's not going away after several days or you're getting worse, you could be getting something like a bacterial pneumonia. Finally, obviously, people who have those underlying conditions that can make flu worse, pregnant women, people who are significantly overweight, people with underlying heart and lung problems, and also the extremes of age, those groups you want to be particularly careful with because they can get very bad flu.
All right, last quick question. A lot of myths out there about this vaccine. What's the biggest one you've seen?
The one that I hear literally every week is, I got the flu shot and it gave me the flu. The flu shot is chopped up dead virus. It can't sort of, you know, recreate into zombie virus in you. It's dead. You really can't get the flu from the flu shot. But as we've heard, there's still a reasonable chance you could get flu even though you got the flu shot, but you didn't get it because of the flu shot. And the other thing to point out is even though it may only be working 50% of the time, you still may get less significant illness. So even if you get sick, you may not get as sick as you would have otherwise.
All right. We'll leave it at that. Dr. Gardam, good to talk to you again. Thank you.
Thanks for having me.
Of course, there are other ways to help stop the spread of flu. The Public Health Agency recommends these. Wash your hands often. Keep your hands away from your face. Cough and sneeze into your arm, not your hand. Keep common surface areas clean and disinfected, like doorknobs, light switches, and keyboards. And if you are sick, stay home.